Welcome to Ask Fabio, your go-to channel for understanding complex topics. Today we're diving into the world of heroin, exploring its effects, dependency, and the risks associated with its use. Heroin, scientifically known as diacetylmorphine, is a semi-synthetic opioid derived from morphine. It comes from the opium poppy plant and is often found in powder form or as a sticky substance called black tar heroin. Originally marketed as an analgesic and cough suppressant, heroin's dangers were not fully recognized until later. Its powerful effects on the brain and body have made it a substance of concern worldwide. When heroin is ingested, it rapidly enters the bloodstream and travels to the brain. There, it converts back into morphine, binding to opioid receptors and mimicking the effects of naturally produced endorphins. This binding leads to a powerful sense of pleasure and pain relief. Heroin also impacts dopamine production, causing intense euphoria initially, followed by a relaxed, tranquil state, contributing to its addictive nature. Heroin's addictive nature stems from its impact on the brain's reward system. The intense pleasure experienced leads to a desire to repeat the experience, creating a dependency on the drug for pleasure. With repeated use, the brain's dopamine production becomes less responsive to natural stimuli. This creates a cycle where users need more heroin to achieve the same effect, leading to intense cravings and dependence. Immediate physical effects of heroin use include pinpoint pupils, dry mouth, a sensation of warmth, nausea, intense itching, and drowsiness. These occur shortly after ingestion due to its impact on the central nervous system. Long-term heroin use can cause severe physical and psychological issues. Physically, it can lead to insomnia, collapsed veins, abscesses, and damage to vital organs like the liver, heart, and kidneys. Sharing needles increases the risk of contracting diseases like HIV. Psychologically, long-term use can lead to anxiety, dysphoria, and depression, further complicating the user's health and well-being. A heroin overdose is extremely dangerous due to severe respiratory depression and hypoxia. This can result in a complete cessation of breathing, leading to death by asphyxiation, making overdoses a significant risk. The fine line between a typical dose and a fatal one makes accidental overdoses common, especially for individuals with fluctuating tolerance levels. This unpredictability adds to the danger of heroin use. Heroin use can significantly impact sexual function in both men and women. It is linked to erectile dysfunction, delayed ejaculation, and decreased libido, affecting overall sexual satisfaction and quality of life. Heroin use can have significant effects on sexual function and the sexual quality of life. Here's a breakdown of the effects according to the sources. Decreased libido. A significant number of male patients, 75%, reported a decreased interest in sex due to heroin use. Impaired sexual desire was reported as the most prevalent psychosexual problem too. Arousal issues. Many men, 71%, experienced worsened sexual arousal, though a small percentage, 5%, reported increased arousal. Erectile dysfunction, ED. Heroin use is linked to a high prevalence of ED too. Studies have shown a significant correlation between heroin use and ED. One study reported that 75.7%, 88.7%, 80.8%, and 80.9% of male heroin addicts experienced ED at the baseline, and the 1, 2, and 3-month follow-ups, respectively too. Orgasm difficulties. A large percentage of addicts, 60%, felt that heroin use decreased their ability to experience orgasm. Orgasm was the most affected dimension of sexual function, followed by pleasure, desire, and arousal too. Ejaculation issues. Heroin use is associated with delayed ejaculation, with one study reporting that 49.9% of users experienced increased or decreased ejaculation latency too. Reduced sexual satisfaction. Most users, 72%, reported that their overall sexual satisfaction decreased while using heroin. Decreased overall satisfaction and decreased intercourse satisfaction are commonly reported too. Dependence. Sexual dysfunction caused by drug use was a factor in the decision of 42.6% of addicts to stop heroin use. Severity of sexual dysfunction, SD. Among chronic opiate dependents, 69% reported mild to moderate SD, and 23% reported severe SD too. Long-term effects. Long-term heroin use is associated with SD in all 5 domains of sexual function: lack of libido, delay in orgasm, inability to orgasm, ED, and tolerance or recognition of changes in sexual function. 3. There is a negative correlation between the duration of heroin use and free serum T levels, and negative correlation between desire, intercourse satisfaction and overall satisfaction, and the age of onset of substance use 3. Other factors. Men seeking treatment for heroin dependence also reported poor self-esteem and relationship issues, poor sexual quality of life and sexual satisfaction, and higher premature ejaculation, PE 3. It is worth noting that a small percentage of users have reported increased libido and arousal, showing that the effects of heroin on sexual functioning are not uniform one. However, the negative impact on sexual health and satisfaction is a significant issue for many heroin users. While some users may initially experience increased libido, the overall effect is generally negative. Reduced ability to experience orgasm and decreased sexual satisfaction are significant issues for many heroin users. Sexual dysfunction caused by heroin use was a factor in the decision of many addicts to stop using the drug. The negative impact on sexual health is a significant issue for those struggling with addiction. Heroin withdrawal is extremely difficult due to severe physical and psychological discomfort. Symptoms include intense pain, sweating, chills, fever, vomiting, muscle cramps, tremors, and anxiety. The sensation of impending death during withdrawal makes it very difficult for users to stop taking heroin. This contributes to the high rates of relapse among individuals trying to overcome addiction. Understanding the effects, dependency, and risks of heroin is crucial for addressing its impact on individuals and society. Education and awareness are key in preventing and treating heroin addiction. If you or someone you know is struggling with heroin addiction, seeking professional help is essential. There are resources and support systems available to assist in recovery and improve quality of life. Thank you for watching Ask Fabio. We hope this video has provided valuable insights into the complex issue of heroin addiction. Stay informed and take care of your health and well-being. Don't forget to subscribe to Ask Fabio for more informative content on a wide range of topics. We aim to provide clear and concise information to help you understand and navigate complex issues. Feel free to leave comments or questions below. We value your feedback and are here to help answer any questions you may have about heroin or other topics of interest. Join us next time on Ask Fabio as we explore another important topic. Stay curious, stay informed, and remember that knowledge is power in making informed decisions about your health and life.